Спасибо. Hello, dear colleagues. My name is Mynzhylky Berdikhojayev, and together with my colleague Shai Ahmed, we are planning to start the case number 3 for streaming, and case number 5 from the morning. SG. Yes. Sonic 1.5 to no, not we have this patient with the brain AVM. I just need to scrub and then I will explain you. Patient had this generalized seizures, and we discussed with family and with the patient about the treatment options, and he was scared. Then we sent the DSA and MR images to the Gamma Knife Center in Astana, and our colleagues from the Gamma Knife Center in Astana discussed the possible option of the treatment to irradiate mostly the medial part of the AVM, but then patient had one more generalized seizure, and he said that he is ready to go for the embolization. And now we did one more angiography. On previous angiography, I didn't pay attention for the details, and now we can see there is an aneurysm on the feeding branch. Табыр ой коннектор бересіз. И екі набор шприц ашсың. Екі набор шприц. Yes, you can see here there is aneurysm. And I think it's better to start with the embo to minimize the sizes of the AVM. Екі набор болады, хорошо? Мен ана гайтқа жалғаймын, сасып кетіп отыр. On the upper branch, it looks like also some kind of aneurysm, but I'm not sure should we treat the upper branch also. But the lower branch, it looks like less functional, but it's a white matter. Okay, let's check the white matter territory, in which territory it will be. Okay, екі система болады. In which territory it will be. First of all, we need to change the we need the two wires. The guiding went through the short 8 French sheaths, and guide catheter is 8 French Hyperion, which is from the Asahi company, and coronary guiding, Judkins, right? It's more stable, and in AVM cases usually artery is enlarged and there is no problem. Мен алам, но жауап бересің. It's usually it's enlarged, and contrast толтырып қойып бересің. Ашып жібер. It's too fast. Yes, the plan was to go from the left MCA territory, but we did the diagnostic angiography before the planning the treatment, and before the sending to the for the consultation for the Gamma Knife Center. That's why we have additional information. But this is an aneurysm, and I think we need to attack this part, but This part is located here, and then we can touch the white matter in this region, and usually it may cause the problem. Okay, if we don't occlude this aneurysm, then we can have a problem. Okay, then we can have a problem. It's look like this. It's coming from the. Yeah, there is one aneurysm here. It also should be treated, but this region is less risky, and I think it's all collaterals, and it's coming here. There is a fistula from the MC, and it's possible to find this branch, and then I think there is no need to occlude all this territory. Let's see, maybe we can find this territory. And this is a fistula, this is a fistula, and this is a MC territory. It's always cortical. This is more close to motor cortex, and this is more distal from the motor cortex. And I think this branch territory is yes, I focused on the case, that's why I forgot to say my assistant is Shai Ahmed, neurosurgeon, this tall guy. Anesthesiology nurse is Zoya. Anesthesiology nurse is Saltanat, operating nurse is Zoya, and anesthesiologist is Mynzhylky, and I think this territory is close to something from this branch is going here. Okay. Yes, Mynzhylky, and video support team is Videon company, presented today with Roman. Roman is a partner of Evgeny. And that's all, I think. Okay. And it's a presidential hospital from Almaty, Kazakhstan. Yes, there's something here. I'll check. Okay, it's better to occlude this part. It's collateral flow coming from here. It's still MCA territory, that's why it doesn't need to go here and occlude from there. Usually it's enough to occlude this branch, if possible, to navigate. And usually it's better to place two guiding catheters. Okay, it's better to put two guidings. And something in this territory. It should be something here. Yeah? That's an eyebrow. Yes, and it's above the eyebrow. 0, 0, and here is some part is here. Yeah? Yes. It's also possible to compress the right IC. It's option number 1. Option number 2, to go from this branch with the microcatheter and do injection from the left. And there is infundibulum. It's look like aneurysm, but it's infundibulum. Okay, we've already done 3D. Yes, it's look like infinity blue. Something like this. And it's less visible, but on MPR we can see nicely this territory, and this territory. Okay. From the middle, we can go from the middle, then there is an aneurysm here. Let's do it a little bit like this. Yes, there is an aneurysmal territory. Option number 2, just place a couple of coils with the headway dual. Yes, it's option number 2, to preserve the artery. Let's check with the sonic if it's possible to do it. If it's not, then we can occlude this segment. It's coming like this, and then it's going to the MCA territory. Okay, it's a white matter, right? It's here. It's exactly, this is coronary suture. Yes, maybe this brain is adjusted, huh? I'm not sure. But all this territory is especially for the AVM. Maybe we can occlude this branch also. Okay, let's see. Not an easy to do decision in such a case. We took a sonic 1.525. I hope the navigation will be not so complicated. That's option number 1. Option number 2, we can go directly from the left side, and we may control everything from the left, but the visibility from the right is better. I especially asked Shah Ahmed to do 3D angiography. If we will go from the left, then we can do 3D roadmap. Yes, in some cases the 3D roadmap is possible, but not in this case. Huh? Yes. It's too early to see the distal branch. It was necessary to go. From the with the two 20 cc syringes, as usually René doing, Professor René Chapeau, and to control the venous phase also. But now we can control only this phase. Or we can do the second reconstruction, but usually machine is using the first reconstruction. For 3D angiography, machine is using the native one. For 3D roadmap. It looks like there, yes. It's visible. It's also visible. This is just saline, this is 20 cc. Okay. Let's go. Yes, in some cases it's very important to have a 190 centimeter sonic, because of the distance between everything. Okay, now we can do zoom. That's too much. Okay, the sonic is arriving. Yes, it's better to go with the J. Do it again. I think this is better for AP and for the lateral. We need to see the pericolosum. As we explained to the patient the possible risk factors, and usually it's very complex to take a decision in a case like this. But the seizures is one of the strong arguments to deal with this kind of назад, стоп, smart mask, назад, один раз. Там нужно будет navigate нажать. Navigate. Родно to breathe Bashir. Осторожно, қолын клёнка шықпай идет. Okay. Yes, and I could not compare the image quality with the sonic system which was used by Professor Chapeau yesterday during the stream from the Essen, from the Icona system, but the voice in real time was really good, the Saudi system, and okay, that's something small. And yes, I hope it's better if Professor Chapeau is comparing the quality, not from our side. Okay, I think for that branch we can go with the okay. Okay. It's not one by one movement. It's a little bit complex to move with these devices in this anatomy. And now I will ask Sheikh Ahmed to do smart mask with the next step. Следующий шаг сделай. Назад. Назад. Стоп. Стоп. Назад. Also, yes, it's like this. There is some kinks, but it's okay. It's look okay, yeah? Okay. But I think we couldn't rotate the whole system in distal anatomy. We'll try. But at the segment with aneurysm, there is a big kink. There's a kink. Yes, it's a kink. Now we are inside the aneurysm. Okay, we should be more careful. Yes, there is a lot of factors there. Okay. Let's check from this point. The problem is it's a white matter, and white matter is quite functional, and we have the limit of the microcatheter also. The extra 5 centimeters at the level of IC, extracranial. Yes, now there is aneurysm. This is aneurysmal point, and it's a deep venous system. Yes, the possible option to go from the deep venous system and occlude all this segment. That's option number 1, no? Okay, that's option number 1. But all these branches are ending in the AVM. Так, назад. Назад. Назад, назад, назад. Назад. Stop. Yes, we need to do angulation and then we can send it forward. Huh? Okay, let's try to do it, but there is angulation at the second and third marker. That's why the pushability of the whole system could be a bit limited. Pushability. Pushability. Ability to be pushed. Okay. I will ask Sheikh Ahmed to collect the squid 12 in the case of emergency. Or we can take a fill. Fill, Alessandro. We have a last fill on the shelf. That's why we can use the fill for the emergency. Then the person. Okay, better. Sure. Oh, it's very comfortable. The new packaging of the fill is very comfortable than the previous one, and real respect to my convention company, which was before, and now it's a Tiro Monero. I will take the fill for the case of any force majeure. It will be here. Right here. Yes, now my microcatheter inside the aneurysm. When we release the whole system, the microcatheter is jumped inside the aneurysm. It's good and it's bad. It's touching the aneurysm. Yes, I don't want to inject inside the aneurysm. Then the risk of aneurysmal rupture is presented, but sometimes it's possible to inject. But injection should be very quick. It's not rotating. There is no any kind of movement. Yes, we need to go to the opposite side. Okay, I think we can inject from here, and it will be very quick injection. Okay, now we're inside the aneurysm, and then we went out from the aneurysm. Yes, as much as possible, it's better to inject outside from the... Okay. It's quite complex, huh? Now we are touching the wall of the aneurysma. Okay, it's rotating. I don't want to take any kind of risk. If it's not okay, now we went out from the aneurysmal point. Okay, let's try to push if it will go. Okay, frontal side. Okay. It's not one by one movement, that's why it might be quite risky. Yes, it's not one by one. Yes, for the case like this, maybe it's better to appreciate the okay. Now the tip of the microcatheter is inside the aneurysm. No? Okay, let's take this 3cc syringe. And I hope we don't create any kind of complications. No? Yes, it's still AVM. Okay. Let's take the DMSO. Дексаметазон оника, наркоз поглубже.
Дексаметазон оника.
It's, I think we need to try to inject quite quick and then retrieve the microcatheter. Glue. Berdikhojayev also. Okay. That's last contrast. Так, еще раз родно. I don't want to inject too much with the reflux, but I think we can inject as much as possible. It's MCA territory. It's the branches from the MCA. I think it's a collateral also. Arterial collaterals. I think it's arterial part, huh? Then we stopped, and then we should do it in a regular way. Yeah? Okay. Okay. Назад. Анау қандай ветка екен? Хорошо.
Adamın içindeki böbrekten.
Yes, now we have a reflux. Now it's refluxing, and if I'll try to retrieve the microcatheter now, then I think we adjust it, and then we occluded little part of the brain part. Okay. Hold this on. I'm not sure. There is a small branch is also occluded. If you can see, there is a small branch here, which is also occluded. Okay, let's check. It might be everything. It might be artery, it might be vein. Okay. Yes, we occluded the aneurysmal part, and now let's check the AVM. Назад. I think all this territory is collaterals, huh? Назад. But the small branch we already occluded now. I'm a little bit worried for the territory. Okay, let's check the MCA before leaving the right ICA territory. Stop. Okay. Yes, it looked like it was something from the lenticular straightening territory. Okay. We could test after the extubation. There's no branches from the left extracranial, only the intracranial is presented. Okay, let's check what's changed. Вперед. It's always venous phase. Yes, the venous hypertension is quite big. Let's do it like this. Let's put it on the reference. This is after, and this is before. Huh? Okay, let's compare what's changed. One. This is after. Yes, this territory looks the same, and there is a straightening branch is also, I think it's also defeating the AVM, maybe, it should. Yes. Okay, this is after, this is before. Let's compare. I think the same Venus patterns. It's the same Venus system. Okay. Now we should go to the ACA territory. Не бересаш? Sonic 1.35. Окей. Ол гибрид пока салып қоясың. Мынаны қолданып көрейік. Жоқ, просто ішінде тұра берсін. Соның ішіне салып қоясың. Ішіне қайтадан тығасың. Керек болған кезде ашып қоясың. As the indication was to take out the aneurysm from the circulation to prevent the possible bleeding. Yeah, отлично. Рахмет. The blood pressure is 84. It's very good. Seksen, 36, 75, нормально. Yes, what we learned from the Essen, the blood pressure should be less than 80 millimeter mercury. Then it's preventing the possible bleeding. Smart mask also. Осал поясом. Вперед, чуть-чуть вперед. Бред вперед. Назад. Навигейт. Смарт маска. Назад. Один раз назад. There is a flow-related aneurysms on MCA and ICA territory. Осал поясом. Yes, okay, let's check everything. Bir headway duo мен Traxxas бересіз? Просто headway duo бересіз? 156. Yes, the Olga from Phoenix company is joined the Angio suite. There is nothing from Phoenix, but I think it should be interesting for the manager. Saunders. Yes, we will take 2 microcatheters. It's better to take headway for check angiography. Let's see. Yes, this small tiny branch in straighting territory is giving some stress, but let's see how the patient will be after the extubation. Time to time, when we occlude the straighting territory, we are touching the lenticular straighting artery till this point, and usually it's not a problem. But it's not feeding the AVM, then it's it could be a little bit risky. Okay, let's see. Now it's just a philosophy, yeah? Just a discussion. Okay, maybe it was better to place the headway door here. And then we lost the extra 5 centimeters. Okay, let's see. There is too much tortuosity, yeah? Yes, and in the case of seizures, in my observation, it's better to occlude the cortical part of the AVM, and then it's possible to control the whole territory. Okay, it looks like there is a bifurcation. Yes, one is going there and one is going back. Okay, let's just take this point. It's too bulky. It's stuck at one level. Okay. Yes, for me it's a territory of this branch coming from the... Now we have no extra length. This extra length. Okay, I think now we reached the territory from this branch, from that branch. And for situation like this, we can use the 3D. Let's zoom in something here, yeah? This branch. And now we can do 3D roadmap. And with the yes, it looks like we are in the territory of in the needed territory. Okay, we have extra 5 centimeter, not the 5, couple of centimeters here. I think we should use this to control. Yes, now we reach the territory, which is coming from the AC. Yeah? Okay, let's do angio. Yes, it's coming from the AC. It's a retrograde feeling. Okay. I think now we're here at this point. Just a second. Now we are at this point, but something might come a little bit up. But I think it's possible to occlude something here, and then it should be okay. I need extra 5 centimeters, huh? I need the extra 5 centimeters. Okay. There is another branch, huh? might be the AVM point, huh? Okay. I think it's the territory is coming from left. Назад. Назад. It's just the branches, huh? It's a collateral branches. Okay, let's follow the same microcatheter. Yes, that's why we should put the headway duo from here. Then it might be more controllable situation, huh? Okay, the sonic is arriving. Okay, in a case of like this, we can do shipping from here. I just rotated the wire, which is a little bit damaged around the sonic, and then my navigation is very smoothly. And I'm just following the previous sonic headway. I'm following the headway. Now I need to take a little bit up. Ну-ка, покажи, с какого момента. Yes, with the sonic we can control a little bit distally than with the headway. Назад. Примерно там, да? Здесь он делает небольшой круг. Okay. My sonic is quite proximal. And here is a rotation, which have been seen from the AC territory. Okay. Okay. Now we are controlling the territory coming from the AC collaterals. Yes, of course, at the territory some it's like this, huh? Okay. Так, назад. Yes, there is a bifurcation and it's going to the MC also. It's going to the fistulated point, which is not the target of today's treatment, but okay, just back. We need to occlude this branch also to exclude all these collaterals from ACA. Вперед. Вперед, вперед. Назад. I think this is a brain. We don't need to touch this part. Okay. It's just a continuation of the ICA territory. Okay. Just a second. If I can push my guiding catheter up, it would be better. Yes. I need extra 3 centimeters. Okay. Give me this one. I will try to push with the 35. I hope it will work. I need 5 centimeters. Yes, with the narrow max, which is 100 centimeter, 90 centimeter, it should be more easy to push it, but with the Hyperion, which is coronary system, it's not so possible, huh? It's not so easy. we couldn't push it. Okay. Okay, maybe we can use some kind of Чекай X. Чекай 6 бересесиш. Maybe with Чекай 8 it would be possible to push it distally. And I think it shouldn't be the target of this treatment. We can, it's the fistulous part. I will just occlude the distal. Yes, the flow coils could be the option. The flow coils could be the option, but we have no flow coils. Huh? That's why it's a little bit problematic. Okay, we will use it as a roadmap. Yes, it's easy to exclude this point, but it's direct fistula. Huh? It's a direct fistula. Okay, let's see what we can do. It was not the aim of this treatment. I will try to avoid occluding this segment. Okay. We should try to avoid to occlude this segment. The fistulated part is better to leave till the end of the treatment, till this last session. But after occluding the fistulated point, it's better to send to gamma knife. Okay. There is a lot of options. Huh? But the aim of the treatment is the ember cure, if it's possible. But too big AVM, eh? Too big AVM. Okay, then we can use something from Phoenix. We have coils from Phoenix. Так, назад, бршак. Стоп, ага, все хорошо. In the case of any problem, we can place the sonic at the level of the upper smaller branch, and we can navigate. Okay. Torque reversor. Yes, it's too complex to push. Just a second. The wire was played at the proximal part, that's why time to time we need a control ranger. I think it's clear. There is a branch. There is a branch. Maybe like this we can push it. Yeah? Okay. We can. Yes, I just need to go till this point. Yeah. Okay. Now it's a nice position. So, all clear. Ниге Mynzhylky пересаш. Кой коннектор жала пересаш, промывка? There is another branch. There is another branch. What's this? What's this? Yeah, but what's this? только посмотри. Okay, I think at the wall of the artery there is another branch. Okay, like this, and then something like this. Stop. I think there is another collateral. Okay. Yes, there is another collateral. I will replace my sonic at the level of headway. If it's possible, we can inject something from here. We can put it it's again going up. I think this level is better. Yes, there is a collaterals. A little bit push the sonic. Yes, I think this level is better. Now they located at the same branch. It looks like there's some collaterals, arterial coming and joining this segment, yeah? It looks like collateral. Предыдущий хочешь? Предыдущий. До него. Еще. Назад. Еще. Назад. Yes, this one. Вперед. Yes, it's a collateral is coming from the anterior territory. I think if we will occlude this segment, it's enough. Y connector. There is no Phoenix coil smaller than 7 mm. Барлы. Артерияның диаметрін өлшесеш? Шайхмет. Сониктен жүрген кезде артерияның диаметрін өлшесеш? Келесі. Жүресің. Okay, let's measure this branch. I think it's a 4 mm or 3 mm. 2x2. 3-8 Феникс спиралін бересіңші? 3-8 ең жоғарысына проводим. Міне. Yeah. Finishing 3-8. Жо, 3-8. И 2-6 пико деген бересіңіз. Софттан кейін пико. Жо. Yes. Бере беріңіз, үшеуін аласыңыз. Окей. 3-8-ден бастайсыз. Оля, ты нас слышишь? Да, это одна из самых лучших спиралей на свете, да. Окей, бегущая строка. Yes, this is a coil 3x8, which is Phoenix complex. Okay, especially for Olga. Non-light артасы, хорошо. Okay, we positioned the two microcatheters at the same level. Now we'll start with the 3x8 coil. We'll coil this segment, and then if it's necessary we can inject something. Just a little bit, to be sure that we are not damaging anything. Yes, the headway duo is located, the tip of headway duo now is inside the branch. That's why I need to release it a little bit. Осындай болды ма? Көресіздер? Ана ангиографияны көрсетесіз. Oh, headway just one. Okay, let's check from here. Yes, it's a branch. It's a coil 3x8. We specially placed the it's quite stiff delivery system, huh? It's a quite stiff delivery system. Okay. Microplex 2,6 бересіз? Okay. The second coil will take microplex, and we need to replace. Так, новайса. Чекаева, да? Headway. Чекаем. 2,6 қайсы бар? 2,8 қайсы бар? 2,8 оптима бере сал. Okay, let's re-navigate the headway door a little bit distally. Yes, the delivery system of the veneer coils, I think, a little bit stiffer than competitor. And now you can see what we can do. Okay. It's impossible to push. Huh? Okay. Now we are proximal part. We can push it. Okay. It's something. Yes, we can push the coil with the wire also. This is another branch. I think the guiding catheter is displaced. Okay. It's the proximal one. It's the proximal. There is another branch. There is another branch. Okay. Okay, maybe now we can push. Headway. Okay. Now it's good. Okay, let's try the second attempt with the Optima, and let's compare which coil system is less stiff. If it's not possible, then it's possible to create the flow coils. I can just detach it here and just push with syringe. It's option number 2. Okay, let's see how stiff the delivery system of Optima. It's not stiff, it's quite easy to push the coil. Okay. Let's again start at the same point. Okay, бересің. Енді microplex 3.8 бересің. The coil number 3, I asked to give a microplex 3 by something, 3 by 8. Okay, let's check them. 3.6 бересің. 3 by 6, okay. Sure. Yes, the microplex is bigger, but maybe it's more controllable. Yes, after placing all these coils, we'll inject a little bit of some liquid to control this segment, and then I think we can finish. Yeah. Okay. We can inject with headway door also. Yes, it's a case of flow coils, just and everything is stable. Okay. Microplex is also went well. It was a 3 by 6. Ah, it's good. It's stopped. Отдели. Так. Авенир 2D6, 2D8 бар бересіз? Феникс. Иә, 2D6 ғой оның бәрі, да? Тұра тұр. Мына жақ ашылса. 3.8 бересіз. 3.8. Soft деген. Finishing, yeah, finish. Yes, let's try the coil Avenir 3 by 8, which is finishing. So, rare. Especially attempting this occlusion to control the branches coming from the ACA, which has also the aneurysmal part, with little hope that aneurysmal part will disappear. Okay, it's quite stiff, but it's still okay. There is a branch. Yes, the Avenir is a quite stiff system. Comparing with the competitors, it's quite stiff. Okay, let's leave it here. Even it's a finishing, it's quite stiff. Okay. There is a fistula. It's a high flow shunt. Okay. Let's take back the sonic. Is it okay, or there is a small branch going to the AVM pointers? Okay, let's see which branch it is. Okay, let's take out the 3D roadmap. It's not necessary now. Okay, this branch is going here. From this level we can point the sonic here. Yes? Which is located here. I think a little bit down it's better. Then we can inject something and a little bit, and then we can go out. Okay, at this point. Okay. I think the position of sonic is not bad. Not so bad. We can occlude all this segment without extending to the fistulated part. Okay. I will avoid to use the fill in this part. Menex on 6 бересінші. We will start with Menox 18 and then we may continue with the Squid 12. Böyle. Tırnağımızın palını. Kayış alsın. Kilesi de katlı kalmasın. And the song fill buldu muydu?
Yeah.
Yes, the fill was the last one. And now I will ask Шай Ахмет to collect the Squid 12. 18-дің қалдығын жинап алды, 12-мен араластырып жіберсең. Okay. 12-ның... Yeah, you can. Okay. Headway duo we'll use for the control. It's located a bit proximal. And through the sonic 1.535 we will start to inject a Menox 18. We will follow the Menox 18 with the Squid 12. Yeah, arrastırır. Shai Ahmed is asking me if it's possible to mix the Squid 12, the last part, with the Menox 18. Yes, it's possible to mix everything. And I think this is the branches, and just occlude the territory. I think it's not the fistula part, it's just the AVM branch, but it's also going to this fistula point. Yes, it's going to the fistula. Ровно? Ладно. I will try to occlude just the beginning of this fistula. Okay, stop. So now is the part of the branch from where we started. I think it's enough. This tool is patent. We can retrieve the sonic a little bit, if it's possible. Okay, now it's coming back. Okay, let's took it out. Okay, it's not going. Okay, анаджинап кайтты. Пока кынай тұрып обратно. Okay, let's check the headway door. Oh, there is another fistula. I think it's a branch, it's not a fistula. Назад, стоп, назад. Вперед. There is a lot of territories. Назад. Назад. Вперед. Назад. Вперед. I think it's possible to stop from this point, huh? Sheikh, what is your opinion? With this as much as possible, then there is another AVM part. Okay. Yes, it's also another argument. Patient has нажерчежом какой-то слайма? Или кожурка?
Нажерма?
Yeah.
Нажерма. Прямой прям шпитня.
Жоқ? Шпит. Перестаночно. Бар трон катетерно. Дем соберешь? I will inject a little bit. Just stop the flow in this segment. It will be through the headway door. Yes, I don't need big reflux. The branch is quite big, that's why. Таза смиряр. Родно? Yes, it's within that space. I think it's the artery, да? Так, тогда чуть пересол. It's not look like the venous part directly. Okay. Let's check. there is no problem till this moment. Еще раз. Родно. Родно. Так, что это было? Пока артерия чувствует, да? Далее недалеко. Yes, it should be the beginning of the fistula from artery to vein, but the diameter is still not enlarged. But I think at this point we can stop. Huh? I think it's better to stop at this point to exclude some injection. Так, не наберешь? Одну? Yes, we are still in the arterial part, and I prefer to stop at this level. Yes. Please take it out. 20 syringe. It's a hajama or hijama. Okay. Everything looks stable. Yes, for the first time treatment, I think it's enough. Так, жена, пояснишь? Прежде. Назад. Вперед. Okay, let's go to the right side to control the branches which come from the... It's okay. Просто классно. Все, стоп. Okay, let's put it in the IC territory. Then it would be better visualization. Barbar kaz bitince kaldık. Okay, let's check. Yes, that branch territory is disconnected from the AVM part. That's good. Okay, let's see. It's look like. Назад. Назад. Вперед. Yes, there is a... Назад. Вперед. Вперед. I think this branch is coming from down. Yes, it's going all the way and coming from down. Назад. And there is another branch coming from back side. Назад. Вперед. Yes, we can try to find this branch and disconnect the same manner, and then we can do complex ACA territory more simple. Okay. Okay. Now I will ask Shahmed to do expercity. Let's wait for the expercity. Okay, dear colleagues, es ist nicht möchte machen. I don't want to work. I will just push as our SN colleagues are doing. There is. Take my gravity. Все, шикатым, шикатым. Yes, then if we are doing with small delay, it's the machine stops. I don't know why. Now it worked. Okay. Let's see the city. This is city. The down part is normal. This is the middle part. This is small part we already injected. Yes, it looks like everything is okay. There is no lateral ventricle shift. Yes, we can stop. See you in next 30 minutes. Next case is cerebral AVM. See you. Thank you for watching. See you.